Tuberculosis,
Tuberculosis,
TB.
TB.
World Health Organization found that tuberculosis, which is TB, is second only to HIV/AIDS as the greatest killer worldwide due to a single infection agent. In 2013, 9 million people fell ill with TB and 1.5 million died from the disease. Over 95% of TB deaths occur in low and middle income countries, and it is among the top 5 causes of death for women aged 15 to 45. In 2013, an estimated 550,000 children became ill with TB and 80,000 HIV negative children died of TB.
I love you, girl. I love you, baby, more. You my world.
What do you know about TB?
Well, I do know that TB stands for tuberculosis, and it is a bacterial disease that affects the lungs, and it, is very contagious. It causes you to cough blood.
An estimated 1/3 of the world's population is infected with tuberculosis. 1/3. And here's the culprit, the minuscule bacterium called Mycobacterium tuberculosis. But does that mean 2.3 billion people are sick? Fortunately not. Only a small proportion of them actually become sick. To understand why, let's take a closer look at the bacterium itself. When someone with TB coughs, they expel little drops of saliva that fly into the air. Some of them may contain the TB mycobacteria, which can then be inhaled by someone close by. The mycobacteria then continue their journey down the respiratory tract and into the lungs. That person is then infected with TB. And this is where it all becomes a little more complicated. The body detects the invasion and sends out its first line of defense. This includes special cells called macrophages, which engulf the mycobacteria and transport them to the lymph nodes, where they are neutralized. If they're neutralized, the person will have what is called latent tuberculosis. This means they're infected with the bacterium, but they don't have active TB disease, and they're not sick. However, in 5% of cases, the immune system is overwhelmed. The TB mycobacteria multiply and escape, and the person falls ill. This often happens with young children, whose immune systems are not fully developed. In other cases, latent TB can wake up and become active TB. This can happen months later, or even years later, especially in adults with weak immune systems. For example, people who are HIV positive, or who've had organ transplants, or who are undergoing chemotherapy. Once in the lungs, the bacteria may spread via the bloodstream or the lymphatic system to other parts of the body, to the lymph nodes, bones and joints, the digestive system, the central nervous system, the liver, or the heart. So what happens when someone has active TB? Let's imagine the infections in the lungs, as this is the most commonplace. The patient starts coughing, has difficulty breathing, and suffers from chest pains. If these symptoms last for more than a few weeks, and are accompanied by fever, night sweats, and weight loss, the doctor has good reason to suspect tuberculosis. The next stage is diagnosis, and then treatment. The battle is far from over.
Risk factors. From World Health Organization who is most at risk? Tuberculosis mostly affects young adults in their most productive years. However, all age groups are at risk. Over 95% of cases and deaths are in developing countries. People who are affected with HIV are 26 to 31 times most likely to become sick with TB. the treatment and prevention done in your country?
Well, to prevent TB, most of us are given a vaccination called BCG, so we don't really get it. And vaccinations are just an exposure to TB to get your body to be immune to it. So when we come to this country and we get the TB testing done, most of the time we test positive. The spot becomes really big. So when I'm asked to do a TB test, I just go straight to do the X-ray. Yes, but I know we get BCG, and those that don't have it is probably because I didn't get to a good hospital. But most of us that were born in hospitals did get.
I started to get sick. I was coughing, I was getting cold, losing appetite and losing weight. I don't know what's happening to me. And I just think that I must go to the clinic. When I got TB, I tried to tell my mom, and I thought she's going to feel sad. No, she was just worrying because she was thinking that, oh, my baby is HIV positive, now it's TB, maybe she's going to die. And the way I was, each and every person can think that I'm going to die. Ew. TB is also like HIV. It can hide. It can hide. So I'm going to the clinic. Okay. They started to give me some medication. Ooh, when I started with that purple one and the white one, I'm feeling appetite now. I want to eat some food.
Combi Zandile, please. So much longer, you're doing so well, we can hand you over to the nurses soon. Maybe your pulse.
There is a big difference, and I'm fresh. I'm fresh, you can believe it.
Okay. Nice seeing you. All the best.
So, to the pharmacy.
To the pharmacy, okay?
I have a dream. I used to see many parents are taking their children in the morning to school, and in the afternoon they are going to go and fetch them. I also wanted to do that. I did survive, because look at me. I'm beautiful, I'm healthy, there is no one that can say, oh, that one, she's got TB. Yo, but now, what's the cake? Only long to sell it.
You or any family members ever experienced TB? Do you know anybody?
No, I personally don't know anybody that has experienced TB. The only information I know about TB, or the only idea I have about TB, is what I've seen on TV or somebody telling me about it, but I have not seen it or experienced it.
AMG baby.